Welcome to Backyard Oasis, a podcast designed by and for older adults living in the beautiful Pioneer Valley of Western Massachusetts and produced in the tech studios at Greenfield Community College in Greenfield, Massachusetts. Backyard Oasis reaches out to older adults who seek knowledge to help them live more thoughtfully, healthily, and happily, who hope to inspire others with their ideas, and who serve their communities in the interest of the greater good. We hope you join us frequently in our pleasant Backyard Oasis for wide-ranging conversations with a diversity of people who are growing older and want to talk about it. Welcome to Backyard Oasis. Hi, this is Dennis Lee. I'm calling this episode, It's Wonderful to Know a Good Pharmacist. My guest today is pharmacist Brian Joyce. He comes from a family of pharmacists. His dad, brother, and now his son is a pharmacist. His dad owned a pharmacy, so Brian's been around the business his whole life. Brian was a pharmacy manager for 15 years at Franklin Medical Center. He's been at Bay State Medical as a clinical pharmacist as part of the critical care team. Today we'll discuss medications and some other ideas to keep you safe. Brian, always good to see you.
Good to see you, Dennis.
It's amazing how your whole family has been involved. I mean, that's incredible. And now your son, too. It's just a great story.
It's actually my daughter. My daughter's the pharmacist. My son, all he knows is he didn't want to be a pharmacist.
Aha.
He's actually a prisoner counselor down in Connecticut.
Similar to a pharmacist.
Yes.
I want to talk today about some of the pearls of wisdom that you have learned over the years. I know that you have talked to a lot of senior center folks. You've gone out and you've tried to help people talking about their lives, and you call them pearls or pearls of wisdom. So that's what we're going to do today. What we're going to go, right?
Sure.
Okay. Let's talk about a lot of the drugs that people use in their life. People, and particularly as you get older, but it may be everybody. Everybody's on. If you look go to somebody's house, there's bottles of stuff, and so let's talk about a lot of the stuff, the bottles of stuff that people have around their house, and how to stay safe and not to have them interact in a bad way. Where can we go with that? What do you want to talk about in terms of the drugs?
Actually, well, you brought up a good point. A lot of people have a lot of bottles of medication around. And as a result of that, when their doctors change their medications, a lot of times they don't get rid of the old bottles. And what they should do is check with their doctor to make sure what they're going to be on, and anything they're no longer on, put those bottles aside. And the twice a year you'll see a Take Back Drugs Day, and they can bring those to there and get rid of them. It's one thing. A lot of people have problems with the extra meds that are around because young kids can get into them, and especially with grandparents, they have a lot of meds around, and they don't always have them put aside, and that's where kids can get in trouble from taking some of these meds by mistake. They grab them, and they're not used to having the house child proofed.
Right.
So it's always good to keep a list of what meds you are on and sequester the ones that you aren't on until you can get rid of them.
So you should put them aside. You wouldn't throw them out?
You're going to, but you're not going to throw them in the trash. So put them aside where they can't be reached by children, and then go to one of the take-backs. You'll see it advertised every so often. It's like April and October they do a drug take-back.
Now, you wouldn't put them in the toilet and flush them?
No, you shouldn't do that because it ends up in the environment, and they're actually finding levels of medications in some of the fish nowadays. So it's better to go back with
some fish that are
who aren't as depressed as they used to be. Yes,
wow. Some fish that are high or something, right?
Go.
Yeah,
yes.
Some high fish. Anyway, let's talk about some specific drugs if we can.
Sure.
That people have around the house that a lot of people use.
Okay, a lot of times you'll see a lot of patients are on statins now, and that's one of the big things for their high cholesterol. So one of the things you got to watch with that is in most cases you don't want to be taking any grapefruit or grapefruit juice along with that. That's one of the big ones you'll hear about. And what happens, it won't hurt you immediately, but if you make a habit of it, what happens is you actually get much higher levels on the statins, so that usually it's best not to take grapefruit along with that.
What do you mean by higher levels on the statins? What happens?
Higher blood levels. It doesn't allow the statins to break down in the body appropriately, and therefore you get taking the statin every day, you start getting a higher blood level than you're supposed to get in there, and it can actually start to cause you problems because you're going to start getting more side effects from it.
Now, I think I've read somewhere or heard that that's the same about grapefruit for other drugs as well, right?
Yeah, that's true, yeah. This one that I mentioned is the most common one. There's other ones, but it's only if you're on them specifically. For example, diltiazem, which is something for high blood pressure. That's another one that you can get a higher level than you would expect if you take it with grapefruit. And you want your doctor, when he gives you a dose, he wants you set at that dose because they know what the effect is roughly after you've been taking it for a while. But if you throw in grapefruit, you start getting a spike in there, and you can actually get too much of an effect on you. And your blood pressure can drop too low. That's when you start walking around and you're so dizzy and you don't feel well. That can be an effect from that.
So what other drugs that people have around the house that we can think about?
To be careful with, or
just how to use, or I guess when people have questions about the drugs they're using, what comes to mind?
A lot of times people will go, when they have questions about medications, they'll go to the internet, which is Dr. Google, as they say.
Yeah.
And sometimes the internet is good. Sometimes it's something you got to be careful with. But I tell people, if you're going to go to the internet for information on your medications, go to good websites. If you're going to look up your condition or your medication, go to like Cleveland Clinic or Johns Hopkins. Those articles that they put in will be checked and are known to be accurate. Just going to Google and finding out what's listed in my monthly med journal or whatever they have there.
How about WebMD? I see that.
WebMD is fairly accurate. Yeah, that's a good source. But I didn't think of that one actually, to tell you. It's not too technical, but it's actually okay. And the thing is, I hadn't thought to tell people that, but I always just tell them to go to the Cleveland Clinic or Johns Hopkins.
The internet is so wonderful for so many reasons, but everything is not accurate.
Yeah,
it's just there,
yeah.
And you got to buyer beware, right?
That's exactly it. Yeah,
I think. Oh, how about some other drugs that people use all the time?
Well, the one thing like ibuprofen, you'll see a lot. The people will use a lot of ibuprofen, which it's there, it's good, but the thing is you should be taking it only for a set period of time. So if you're using it for pain or inflammation or whatnot, you want to make sure that you stop it after a set period of time, 2 or 3 weeks, when whatever the cause of or the need for this is resolved. Some people will get on it and keep taking it when they don't necessarily need it. And that can actually do damage to your kidneys over a long term, so you don't want to do that. And long term meaning many years, but it's not uncommon for somebody to start on it in their 20s or 30s and keep taking it indefinitely. Mm-hmm. We talked before off camera or off mic about the omeprazole. People get put on that. It's a good drug as far as being used for short-term use. There are certain cases where it can be used long-term, but most people should only be using it for 2 weeks, 3 weeks at the most, and then get off it, unless they're directed by their doctor to stay on longer. Ibuprofen is one of those also that you want to get off it, when you don't need it.
Mm-hmm. How about Tylenol?
Tylenol? Tylenol is a good, relatively safe drug. You're going to get most all of your pain relief from 2 regular strength Tylenol tablets, 650 milligrams. They do sell the 500 milligram tablets, might help a little bit more, but for the most part, if you really want to use that much, get 3 of the regular strength. That's 975 milligrams, and it'll save you money when you buy it that way.
Wow. It's interesting. I just bought some Tylenol last night, extra strength. I figured, I got it.
It's okay, but you got to be careful with that, especially for poisonings, because it takes a lot less of that to get poisoning. So if you have it out where kids can get it, they can cause a poisoning much quicker with the extra strength.
Now, what is it that I read online? Once again, I did look online, or I looked at their directions. Mm-hmm. It said no more than 6 tablets a day. I think that's what they were saying.
Yeah, the extra strength. Yeah,
Yeah.
It used to be a little bit higher, but they found that was causing more problems. So now they're bringing it down to 3,000 milligrams a day, which if you do that, that'd be like 9 of the regular strength tablets. But that's pretty much what the going rate is now. The doctors can order a little more higher dose in the hospital because they're watching it, and it'll be for a short period of time, but they won't recommend you do it for a long period of time.
As long as we're talking about the drugs that you have mentioned, let's talk about generics versus name brand.
Mm-hmm.
There's a lot to talk about there.
There
is it the same thing, or how do you look at that?
The generics on prescriptions are required to be within a very small window of similarity. They have to be very close to the exact or very close to the brand name. So when you get a generic in a retail pharmacy, you know it's going to be generally okay. And I have no problems with going with generic creams and ointments or most all of the medications. There are a few of them that people will have issues with, and they will go with a brand name medically necessary. And that can be several different things in it. It may not necessarily be the active ingredient that they're having the problem with. It could be the inactive ingredient. Some brand names will use lactose or not use lactose, for example, and people are allergic to lactose or severely intolerant of it. And one of the generics may or may not have that. So you'll see sometimes they'll use a specific brand to either avoid it or to have something that's in it.
But by and large, people shouldn't shy away from generics?
No, generics are fine. On the over-the-counter medication, however, that's a different story. Over-the-counter meds are not controlled by the FDA, and a lot of people think it is. And that's where there's really no supervision over over-the-counter products. So what I tell people to do is if you're going to get a generic of a medication, buy it in a drugstore. Buy it in one of the chain drugstores or a private drugstore like Cereos or
Right.
Baker's up in Deerfield. There's another one. Buy it in those places because the products they have will be either their own product or it will be like a large company that's making them, a large drug company, and their reputation is on the line.
So in other words, if you go into CVS or Walgreens and they have their brand of Tylenol,
I would have no problem getting that.
That's no problem.
That's fine.
You're comfortable with that.
Yep. There are organizations that will go around to like health food stores and different locations, big box stores and all these different places, and take a certain drug and buy a whole bunch of them from different, and then test them. And in some cases, they're finding out that some of these are not even what's listed on the label, or not the dose that's listed on the label. But you know they have to be in the chain stores or in pharmacies and so on.
Now, I know there's some people, I think my mom said, no, I want the name brand. I said, Mom, the generics are okay. Yeah. But she didn't really believe that. But I said, if you want to pay less, I think they're the same. And so I convinced her, and I do it for myself. Yeah. I try to get the generic, but I think the question's an important one.
Yeah. As I say, for the generics, I will go with that if I buy it in a drugstore or a pharmacy of some kind, some retail pharmacy. I don't buy them in the big box stores. I won't get them there.
Let's talk about any other drugs that people use commonly or that are these days that people should know about or think about.
Well, there's you were mentioning about drug interactions, and there are several. There are many drug interactions, especially with all the meds that people take sometimes. Usually, and the drug interaction can be you're taking two drugs and they interact, and one may make one stronger, may make it weaker, or whatever. And there is actually one that I can think of where it's a 3-drug combination. People take 3 medications, and that combination can actually cause some serious injury with your body. So this is why you want to make sure, or why it's a good idea to go to one pharmacy. And the reason for this is when you buy in the pharmacy, they keep a record of whatever you're getting for your prescriptions. And each time you get a new prescription, it will actually check in the database, and the pharmacist can then look at that and compare all your different meds to make sure you don't have one of these 3 drug combinations or a 2 drug combination or whatever. And that's safer for you. If you buy one drugstore and you go to a different one the next time, and you go to a third pharmacy, all your meds are scattered all over town. And first off, it's inconvenient for you, but secondly, they can't all the computers don't all talk to each other. So your pharmacist is at a disadvantage not knowing what else you're on. So they can actually save you a lot more problems by getting one pharmacist, one pharmacy.
Well, like I said in the introduction, it's wonderful to know a good pharmacist.
It really
right?
is.
It makes a difference.
It does.
I read somewhere, I don't even know where it was, but years ago, that said most people have more faith or comfort with their pharmacist than their doctor because they see him and they have a relationship. And with doctors, you're in and you're out, and they're just more comfortable with the pharmacist.
I've read that too, and I mean there are a lot of good doctors out there that are really good. The problem is they are so busy, and there's so few of them in this state in particular, and that they're awful busy that they don't have the time to spend with people. Whereas the pharmacist, granted, a lot of times the pharmacists don't have time till later on in the day to talk or something, but usually if you know one, you can give them up a call and ask a question. But people often feel comfortable because they see them more on their level. And they don't hide things from the pharmacist that they will hide from the doctors. Sometimes people don't want to tell the doctor a symptom that they're having because they're either embarrassed or they think, well, you should know I've got this problem or whatever. And it's not always the case. The doctor's not going to know that. But they'll go in and they'll tell the pharmacist that they've had this ache in a certain way or something, and like, well, you probably should have told your doctor that one. But,
now, it must be different. I'm going to jump a little bit off of the medications, but when I knew that I was going to talk to you, I thought, you're a person that started working in a pharmacy around it all your life. Now you're doing more clinical things, right? Are you dealing with the patients as much or not?
What we do, it's interesting. Hospital pharmacy is different from retail pharmacy. And I do my 1 4-hour shift a month down at Cerio's and do the retail.
In Northampton.
In Northampton.
Yeah.
So I get a chance to actually get out and talk to a patient and so on.
Which you probably like, because I know you're a very social guy. I should also say, which has got nothing to do with anything, I've known Brian a long time, and I pray that I run into him because we always spend about 10 minutes telling jokes. And he likes people, and he's easy to talk to, as you can tell just listening to you. So you must really like doing the non-clinical things and just talking to people.
Yeah, I do. In the hospital, I don't get to speak to them very often. I work the second shift, so I'm down in our central pharmacy. But what happens, I'm working on the computer mostly, and all orders come down to the pharmacy as they're put in. And it gets checked by a pharmacist to make sure, between the computer and our knowledge, we know there's no drug interactions, that the dosing is correct, considering everything. Because we have to consider not just the dose of the drug for the condition, we have to consider the person's either renal function, or kidney function, or liver function that could impact the dosing on certain medications. And so we have to make suggestions for changing the dose if necessary. And so I don't see the patients very often, and I do a lot of talking with the doctors and the nurse practitioners and the PAs and the nurses, and answering questions drug questions is one of our big things that we do.
Mm-hmm. Let's talk about vitamins and herbs.
Okay.
Because if you go online, particularly, you can spend a day and a half looking at them.
Sure.
And some people believe in vitamins,
Mm-hmm.
and some people think, like my doctor, I think I asked him one time about vitamins, and he said, other people say, oh, it's great. So in your experience, you're not a doctor, but what's your thought about vitamins?
Oh, there's certain vitamins that I think everybody has a favorite one or two. People ask me, should I take a multivitamin? If you eat well, it's not really necessary. If you are somebody who picks at their food and doesn't eat very much and you're really haphazard with that, I would say take a multivitamin just to make sure that you get everything you need for your vitamins and intake daily. The thing I worry about is people go and use very high doses of vitamins, and that's where you can run into problems. Now, there's water-soluble vitamins and there's fat-soluble vitamins. And your water-soluble vitamins generally do not build up in your body. They will pass off if you take too much of them. But there is an exception to that, and that's vitamin B6. That can build up. So a lot of people will have high doses of B6 and so on in some of their formulations that they want to take. And you don't really need a higher dose.
So what's the general rule? If somebody thinks they want to take a vitamin, what's the rule they would use in terms of what they should take or how much? Like you said, people overdo it.
Right. Like vitamin C is a big one that everybody talks about. We take high doses of that to prevent myself from getting colds is what I hear a lot of times. That's fine, but vitamin C at 1,000 milligrams or more can actually thin your blood. And that's, for the most part, on a general person in good health taking that and only that, that's not really an issue. But if you have somebody who's on a blood thinner and they're taking this along with that, that can actually cause a problem. So taking in the normal dosage range is very important. Also, vitamin C is fussy about who takes it. If you're 75, 80, and you're taking it and your kidney function is not as good as you used to be, you can build up too much of that in there, and you can actually have issues when it gets too high. Again, thinning the blood and so on. Vitamin C also, if it's old, people will buy big bottles of it in the big box stores, and this is why I don't recommend it. You get that, it changes its chemical structure if it's exposed to a lot of moisture or it's old, and it can actually form oxalic acid in your body, which is kidney stones. So you want to take a lower dose of that stuff and stay 100 milligrams, 250 milligrams a day is fine. You don't need to be taking 1,000 milligrams. People like to take vitamin E because at one time that was the thing that was going to make you strong, and it would be a great thing. Well, vitamin E 1,000 units or higher, which is now what do they call? That's going by. They changed it over to milligrams now, and I'm still trying to get used to that. 450 milligrams would be 1,000 units, and at that level or above, it can thin your blood also. So you've got to be careful. You need to keep it lower than that. And I tell people if they really want to do that, 400 units, which is 180 milligrams, is fine a day.
So if I went into the Pharmacist at some place in Northampton or here in Franklin County, and you should ask the pharmacist, would he tell you this is what you should take?
Yeah, they'll tell you, what are you looking for? Why do you think you need to take it? And once you get that impression, or they get that impression from you, they can help you with that.
That's great. By the way, we're going to talk about the wonderful world of phlegm. I was just talking to Brian before we started. I've had a cold, and I've never had a cold like I guess it's going around. There's something that's weird. I've never had like them in my life, anything like it. I've never seen anything like it in my life. And you said some of that stuff is going on, and you gave me a way for people, if they're coughing, to reduce phlegm. So I bet you never woke up this morning, folks, thinking, what can I do for phlegm? This is it. You've come to the right place.
Yeah. Coca-Cola. If you drink Coca-Cola, it will break up the phlegm and makes it easier on your stomach. Because a lot of times when you get that draining like that, your stomach is very upset from it. And this will help. It's because your body can't digest it. So you drink Coca-Cola, it helps to break it up and helps your stomach to ease off, actually.
You were telling me about exercises, though. What were you telling me about holding your breath or something?
Yeah, you can do this at home if you're being bothered by a cough like that. If you can just do deep breathing exercises for like 10 minutes 3 times a day. You just breathe normally. Don't breathe to the point where you're going to get dizzy. You just breathe normally, but instead of just breathing in and out, breathe in, hold for 1 full second, and then exhale. And just do that for 10 minutes. It will probably get you coughing, but that will help to clear your lungs out. If you can do it 3 times a day, it's terrific. Sometimes a lot of people get bored with it and they don't want to do it. That's why you get kids' bubbles, and you blow the bubbles. You inhale, blow the bubble, hold it 1 second, and blow the bubbles, and do that for about 10 minutes 3 times a day, or 2 or 3 times a day, and you will find yourself getting over it quicker.
Interesting. Very interesting.
Another thing that people talk about is the coughing at night, and that's an issue. What you can do with coughing at night is if you prop yourself up a little bit, you won't cough as bad, because it's the old treatment for what they did before they had cough stoppers. And if you put pillows down, you're going to knock yourself off the pillows and it won't work. But if you lift up the mattress and put a pillow in between the two mattresses, and then be that way, it'll tilt you up a little bit. And just having you tilting up like that will make it so that you won't cough as bad during the night.
That's interesting. I saw something in some of your notes, and I really smiled just thinking, why would he have this in his notes of things he had done for pearls of wisdom? And you talked about the problem of having a wallet in your back pocket. I never thought about this before, and it kind of amazes me, but it makes sense.
Yeah, this actually has been written up twice that I know of in JAMA, Journal of American Medical Association. One back in the 80s, one back in the 90s. It's probably been written up since then. But it's generally men carry their wallets in their back pocket more often. But there are women who have wallets in their back pockets too, or something in their back pockets. They have a wad of paper towel, for example. But when you do that, when you're sitting, you normally sit with your hips level and your back straight. And when you put something on one side that's a wallet or some wad of something in the back, a big bandana or something, you will still sit up straight, but you're going to start to pinch your nerves because your hips aren't perpendicular any longer. So you'll also find that the wallets can actually pinch the sciatic nerve on that side and cause a numbness down the leg. So if you take the wallet out of the back pocket, a lot of times that will help to stop that sciatic effect that you get. It also will stop the backaches and so on like that. And if the wallet is what's causing it, which it often can, and people who have back problems will trigger off more often if they carry a wallet in their back pocket. So get used to putting it in your front pocket.
Okay. That's great. That's interesting to me. That's very interesting. How about shoes?
Yeah.
I saw somewhere that if you have the bad shoes, it can hurt your back.
Oh, it can, yeah. Usually when people tell me they have knee problems, the first thing I tell them is to look at your shoes. How long have you had them? How long have you been wearing these shoes? Are they worn? And a lot of times they'll say, oh, they look fine. I've had them for a couple of years and they fit like a glove. Those are the worst kind because they're great. They do feel good, but what's happening, the insides of them are wearing out. And you end up stepping poorly when you're walking in them, and you'll find that you're going to get knee problems, and then it can go moving up to your hips and your lower back. Usually I tell people if they've been wearing their shoes for about a year, it's time to think about replacing them. And it's a very simple fix. And one way to find that out is if you notice your knees bothering you or your back bothering you, and you're wearing a certain pair of shoes, take those off. The next day, wear a different pair. And maybe go a couple days and wearing a different pair. And if it's a newer pair, and you don't have that pain, then put the old ones back on. And if the pain comes back, you know it's the shoes that are causing it.
How about, and if I get into this, I'll get angry as I'm talking about it because I have a few opinions on the TV medical ads, which drive me nuts. And nobody asked me for my opinion, but I'm going to give it. I think it's dangerous. I think I like going to a good doctor and a good pharmacist, and they always say, ask your doctor if you need something. I want to go to a doctor that tells me what I need. I don't want to be hawking their products so they can make money. But how do you feel as a pharmacist?
I think this is a bad idea. I get people asking those questions, what they saw on the TV, and I talked to several doctors about this to see what they think. What they're seeing as a result of it. And what's happening is they're having people come in and say, I saw this on TV. I know I have that problem because I got these symptoms and I need to have that medication. And the doctor will be trying to convince them that you don't need that medication. That's not what you have. And they don't want to hear it because the TV told them it was what they had. So I think that's irresponsible that they do that advertising like that.
If I hadn't paid for my TV, I probably would have put my hand through the TV when I heard somebody say, don't use medication X if you're allergic to it.
Yeah.
No kidding. I mean, give me a break. When I hear that, I go, that makes the whole commercial just ridiculous to me.
Yeah. I think they're required by legal aspects. They have to put that in, but still, yeah, it does. I hear that and I laugh too.
Yeah. Well, this is fascinating, and people want to stay safe. We had mentioned before, I don't know if it's the same thing you were talking about poisons and grandparents and kids. We talked a little bit about that people should watch. Are you talking about other poisons, or are you talking about what we were talking about before?
Pretty much before. The medications that grandparents have in their home, a lot of times they aren't child-proofing the home because they don't have the kids around very often. And also, you can get the medications. A lot of grandparents and so on will get the tablets in a non-child-proof cap at home because they're going to be home and they can just flip off the top of it, and so much easier than these child-proof caps are. So they have to remember that they have those in the house when the kids come over, and of course make sure that the kids stay away from it, because that's where a lot of poisonings happen, is at the grandparents' house, because they're just not ready for it. And it's nothing against anybody. It's just they don't think about it. They're through with their kids, and they haven't had the little kids around for years, so
right.
It takes a little getting used to.
And I don't think that's something you would normally think about.
No,
right? In other words, you might think, I don't want to have bad chemicals around for my grandkid, but I don't think you would be thinking about medications that are on a shelf or something.
Yeah, it's only for blood pressure. It's not dangerous, but it is if somebody who doesn't need it takes it. Yeah, that type of thing.
Well, this has been great. I hope we've helped a few people, at least making people think about some of these things, and then maybe they have more questions for their pharmacist.
That's a great one. That's a great source right there. It's hard. They're so busy, the chain stores especially. Well, actually, all of them, even the private drugstores. They're so busy there. But the pharmacist will take the time and talk to you if you need, or you can set up an appointment time with them to go in and talk to them, that sort of thing. But don't be afraid to ask your pharmacist. They can help you with anything.
I'm glad I asked you. And I just want to say, is there anything else that you wish I asked you? Anything that we should have mentioned?
Oh, I can't think of anything off the top of my head.
You mean we did this correctly?
Yeah, I think so.
Unbelievable. Brian Joyce, I'm glad I know you. I'm glad you were here on Backyard Oasis, and thanks for being with us on Backyard Oasis.
Very happy, Dennis. Thank you so much.
This concludes today's podcast. We're always looking for new ideas, so feel free to reach out to Judy Raper, Associate Dean of Community Engagement at Greenfield Community College, at 413-775-1819. If you have an idea you'd love to share. Special thanks to the creators of Backyard Oasis, Denise Schwartz, Chad Fuller, Dennis Lee, and Christine Copeland. Have a great day.